Hello, my dear future nursing officers. Welcome you all to the master nursing classes. So, in the last class of the pharmacology, in the second portion, we have discussed the most important questions and concepts on the adrenaline atropine, where we have discussed a lot of the important things on the atropine and all the golden point chanting we have done on the atropine. And along with that, on the adrenaline, in the different situations like neonatal resuscitation, how to use that one, and in the adult CPR or the adult cardiac arrest, how to use that one, and most importantly in anaphylactic shock, how to use the adrenaline as a drug of choice. Everything in perfect in simple, and I have explained you people. And along with that, we have discussed the very important questions on the levodopa and carbidopa. Okay, so along with that, we have discussed the drugs to contraindicate in the glaucoma and the drugs to give in the glaucoma. Okay, so many more important things we have discussed in the last previous class, and in the today's session we are going to discuss the again very important questions and concept on the pharmacology. So this is the final class where I am conducting, and I'm winding up the pharmacology. Okay, so at the end of the video, I will tell what to do to revise this one perfectly. Okay, so do watch the video completely till the end. And if anyone of you are new to the master nursing classes, fatafat do subscribe to the channel and hit the like button. A very good evening to one and all who are watching the class live. So please hit the like button. And if anyone of you are new to the session, so please subscribe to the channel, right? So without wasting the time, we will start the today's session. Yes. So here, students, with these powerful motivational lines, we will start the today's session. Some people are there around of you. They will judge you according to their view. If you are wearing the nice cloth, they will show. They will tell you are showing off. If you are wearing the simple clothes, they will tell you are a poor man. And if you are successful, they will tell you he is very arrogant or she is very arrogant. And if you are struggling, they will tell you you are doing nothing. You are the lazy person. So according to their view, they will judge you. But what you have to do is to avoid the unnecessary peoples and don't mind about the unnecessary peoples what they are judging you. Okay. There are the two type of the peoples around of you. Some peoples will create the positive vibe, and some peoples will create the negative vibe. So where you have to just connect to the positive vibe peoples, and unnecessary negative vibe peoples try to avoid, especially during the your preparation times. Okay, so this is the clear word from my side. Okay, don't think what others say to you. Okay, if something looks wrong to you, you can analyze that one. Okay, if something looking right to you, so don't mind about that particular word. You just initiate it and finish it, right? So yes, with this particular motivational lines, we will start the today's session. And here comes to the first question in front of you. So please do read the question carefully and completely and try to give the best answer for this particular question. Yes, here comes to the first question. A question on the paracetamol toxicity. Okay, a 30-year-old woman presents to emergency department with 6 hours after the intentional overdose of the paracetamol. Okay, and her initial symptoms including the nausea and vomiting. What is the first line antidote for the paracetamol poisoning? We have to use this one. Okay, so option A is the N-acetylcysteine, and option B comes to the activated charcoal, and option C comes to the plumazanil, and option D is the naloxone. So what goes to the correct answer? Okay, in the last previous class, means in the first class, I have revised all the antidotes. Okay, so in that one, in that particular chart, the antidote of the acetaminophen or the paracetamol also I have mentioned. Okay, so yes, many of you have given the correct answer. That goes to the correct answer for this question is the N-acetylcysteine. Okay, better. So remember few more words from the paracetamol toxicity. So first of all, paracetamol is the antipyretic drug, and which is mainly used to reduce the fever. Okay, and another name of the paracetamol is the acetaminophen. Okay, so what is the another name of the paracetamol? Another name of the paracetamol is the acetaminophen. Okay, so that's the very important. Do keep in your mind. Whenever there is the paracetamol toxicity happens, that time which organ mainly damages? Yes, so please comment the answer. In the paracetamol toxicity, which organ mainly damages? Option A, liver. Option B, liver. Option C, liver. Option D, liver. Option E, all the above. Yes. Yes, very nice of you. Okay, so that is the option A, B, C, D, and E goes to the correct answer. So main organ which damages in the acetaminophen toxicity or in the acetaminophen overdose is the liver. Okay, and paracetamol is the hepatotoxic drug. Okay, previously 3 gram of the 3 gram of the PCM or the paracetamol we can give per day. So this was the recommended dose. Okay, so now we can give the 4 gram of the PCM per day. Okay, if you are giving more than more than of the 4 gram of the PCM per day means it may increases the risk of the acetaminophen toxicity. Sir, how to manage this one? Because in the every Norcet, even every alternative Norcet, there was a question from the paracetamol, so it is a very important to revise the paracetamol. Okay, so there is a simple question they will ask on the paracetamol, but according to the guidelines and according to the standard rules, we need to study one time. So we need to expose it one time, so that is better for us. Okay, if the examiner is asking in depth also, we can easily crack that one. Okay, yes, I told the paracetamol is also called as the acetaminophen. Okay, acetaminophen. When the patient is having the excessive acetaminophen or the paracetamol overdose, if the patient coming within 4 hours of the paracetamol overdose, so first drug we are giving is that is the activated charcoal. Activated charcoal we will give. Okay, so this is the mechanical universal antidote. Okay, so that will helps to prevent the absorption of the paracetamol, and it will helps to eliminate the PCM through the our what we can say from the like anal canal. Okay, so from the stool it will get eliminated. Okay, if the patient is coming after the 4 hours means, so we will give the antidote directly. So that is the antidote. So that is the N-acetylcysteine. N-acetylcysteine. Okay, so in the given question, there is in the very important evidence the patient is coming to the emergency department 6 hours after, means 4 hours have been passed, and in the questions he is mentioning what is the first line antidote. Okay, so antidote is the N-acetylcysteine, and 6 hours already 4 hours have been crossed, so we will give the N-acetylcysteine. So activated charcoal not goes to the correct answer. Hope it is clear to every one of you. Here comes to the next question. Yes. Which of the following is the common pulmonary side effect of the amiodarone? But amiodarone is the drug we are using in the treatment of the arrhythmias. Okay, so please do remember the 2 golden words on the amiodarone. Amiodarone is the drug we are giving in the treatment of the arrhythmias, and which is having a side effect on the lungs. So which side effect is that one? Option A, pulmonary fibrosis. Option B, acute bronchitis. Option C, asthma exacerbation. Option D, pleural effusion. What goes to the correct answer among these 4 options? Yes, I am waiting for your answers in the comment box. So fatapat do mention the answer. Which of the following is the common pulmonary side effect of the amiodarone? Okay, so amiodarone is the drug we are using in the treatment of the arrhythmias, right? Well done, beta. Okay, so amiodarone is having the very dangerous 2 side effects. Okay, so very dangerous 2 side effects of the amiodarone we need to remember here. Okay, so one is side effect of the amiodarone. In the side effect of the amiodarone, so we need to remember the 2 things, especially one is the thyroid gland damage. Okay, along with it will cause the lung fibrosis, and almost all you have given the correct answer. Okay, so that is the amiodarone which is having the pulmonary fibrosis. So this goes to the correct answer, and the 2 times asked question, and in the recent INSCAT also the question have been repeated. So I have presented this question in front of you all. Okay, so previously also I have discussed this question. Okay, again I am discussing because it was asked again in the recent exam, so there is chances there. Okay, so that's what I have brought the question in front of you. Okay, so hope it is clear to every one of you. So next comes to the amiodarone. One more very important thing you have to remember, the blue man syndrome in the amiodarone. Okay, so blue man syndrome in the amiodarone. What is the meaning of the blue man syndrome in the amiodarone? But whenever you will give the amiodarone, so it will get accumulates. Okay, it will get accumulates in subcutaneous fat. Okay, and which makes the person to looks blue color. Okay, so that is the reason whenever the patient who is taking the amiodarone, so if the person is getting blue in color, okay, so due to the accumulation of the amiodarone in the subcutaneous fat, we call that one as a blue man syndrome. So please do remember this particular very important golden point. Okay, so blue man syndrome is seen in which case? Blue man syndrome is seen in a patient who is taking the amiodarone. Okay, so 2 very important side effects. One is the thyroid gland damage, another one is the pulmonary fibrosis. So pulmonary fibrosis question repeatedly asked in your exam, so please do remember the correct answer, option A. Okay, so here comes to the next question in front of you all. So please do read the question carefully, completely, and try to give the best answer in the comment box. Yes, which of the following factors increases the risk of hypoglycemia in a patient receiving the amphotericin B? Yes, a patient who is receiving the amphotericin B. Okay, so which of the following factor which increases the risk of the hypoglycemia in a patient who is receiving the amphotericin B? Option A goes to the concurrent use of the oral hypoglycemic agent. The patient is using the amphotericin B also. Along with that, concurrently, he is using the oral hypoglycemic agent also. Option B comes to the high dose of the amphotericin B. Option C comes to the impaired renal function. And option D is the all the above. So what goes to the correct answer? Yes, which of the following factor increases the risk of the hypoglycemia in a patient who is taking the amphotericin B? Answer goes to the all the above. How, sir? Yes, let me explain. Amphotericin B, first remember the golden word on the amphotericin B. Amphotericin B is the drug of choice in case of the collagen. Okay, so what is the drug of choice for the collagen? What is the drug of choice for the collagen? Yes, the collagen drug of choice is the amphotericin B. So please do remember the very important golden word. Okay. So next, how it will causes the hypoglycemia and how we need to administer the amphotericin B. So practical question may arise in your exam. Okay. So amphotericin B, whenever you are giving the amphotericin B, so this one, what it will do? It will prevent gluconeogenesis, and it will also prevent the glycogenolysis. Okay, means new glucose will not form. Okay, old glucose the body will use that one, but new glucose is not forming here. So that is the reason patient may land into the hypoglycemia. Okay, so if the patient is taking the amphotericin B, patient will land into the hypoglycemia, and along with this, if the patient is taking the other concurrent use of the oral hypoglycemic agent like metformin, glyburide, glimepiride, he is taking. Okay, so OHA again it will decrease the blood glucose level, so this one also increases the risk of the hypoglycemia. Okay, and the patient kidney. Okay, so next, concurrent oral hypoglycemic agent is also using, and amphotericin B also using. Yes, it is also increases the risk of the hypoglycemia and high dose of the amphotericin B. But you are giving the excessive amphotericin B, means it will excessively blocks the gluconeogenesis and glycogenolysis, and excessively it will cause the hypoglycemia, right? So overuse of the amphotericin B, again it will cause the hypoglycemia. OHA you are using along with amphotericin B, again it will increase the risk of the hypoglycemia. Okay, so along with that, the very important one is the last option, that is the impaired renal function. Okay, this amphotericin B, it will completely excrete from the kidney, right? So if the kidney is function is impaired, if the kidney is not functioning well, means the amphotericin will not go out of the body. Okay, if the amphotericin B keeps on accumulating in the body, means it is keeps on blocking the gluconeogenesis and the glycogenolysis, and again it will land the patient into the hypoglycemia. Okay, so that goes to the all the goes to the correct answer for the particular question. So it is the a very important thing just to keep in your mind, and very important thing. So that is the reason whenever the patient is using the amphotericin B, so how we have to administer the amphotericin B? Yes, we have to administer the amphotericin B by diluting into the dextrose 5%. Okay, in the dextrose 5%, we will administer the amphotericin B. Okay, if this one is not available, we can give this one into the dextrose normal saline also. Okay, so first priority you have to choose for the dextrose 5% to administer the amphotericin B. Okay, so hope it is clear. Hope it is clear to every one of you. Yes. So here comes to the next question. Yes. A 65-year-old patient is on the long-term warfarin therapy. The patient is taking the long-term warfarin therapy. Okay, and is present with the blue discoloration of the feet. So which color is there? Foot is the blue discoloration. Particularly noticed in the, especially in the toes, it is happening. Okay, the patient is otherwise stable with no obvious signs of the infection, and there is no any trauma. So what is the most likely cause of this condition? Students, option is the warfarin-induced skin necrosis. If the patient is experiencing the skin necrosis, the color will not be blue. If the patient is experiencing the skin necrosis, the color may be here black, or color may be a brownish black. Okay, but they have given this one as in the blue. So this is not in the warfarin-induced skin necrosis. I am eliminating the option A. Then comes to the option B, microembolia from the warfarin therapy. Yes, whenever the patient on the long-term warfarin therapy, Okay, so that time it will causes the microembolia, means a small clots which is attached to the wall. Okay, it will dislodges and it will comes into the circulation, and the flowing or the floating thrombosis, what we call that one as in the emboli. Okay, so that is the small emboli we call as the microemboli. Okay, this microemboli from the warfarin therapy, it will comes and it will block the small arteries. Okay, so that is blocking the small arteries means distally it is not sending the any blood, especially in the twice. Okay, especially in the twice, so it is not sending the any blood, and the twice become is the bluish discoloration here. Okay, so that's the answer goes for this particular question is the yes, blue discoloration in the feet and twice, which is happening due to the long term use of the warfarin therapy, means the cause is the microemboly from the warfarin therapy. This goes to the correct answer, option B. Okay, so hope it is clear to every one of you. So these are the very important recently asked questions, and in the last, not this year, so previous year INCSE, and the before that some medical exams, and in the sometimes they have directly asked me the nursing exams also. Okay, so please do remember these are the very important questions. Okay, so the next question is here in front of you. Yes, a 7-year-old child presents to the emergency department with a sudden onset of the vomiting. So what happened to the child here? So what is the age of the child? Age of the child is the 7 year here. Okay, so now he is coming to the emergency department. Okay, so now child came to the emergency department with a sudden onset of the vomiting. He is completely lethargic and altered mental status. Okay, so something which is wrong with the brain and something which is wrong with the GI system. Vomiting is there, lethargy and altered mental status, something which is wrong with the brain, and vomiting is there, so which is something which is wrong with the GI system. Okay, so the child recently have the influenza like illness. Yes, the child recently have the some flu. Okay, so that is the influenza like illness. Okay, was treated with aspirin. Either ho gaya galti. So whenever the child is having a viral fever or the influenza like fever, so never ever give the aspirin. If you are giving the aspirin in a child with the influenza like syndrome, there is a chance of the one syndrome. So which syndrome is that one? Yes, so let me clearly and completely read the question, so then it will helpful. Okay, so on examination the child is drowsy. Whenever you will see the child, so child is drowsy and hepatic dysfunction is there. Okay, so liver is damaged here, so that was I told something which is wrong with the GI system. So here the hepatic dysfunction is there and the jaundice is there, and sign of the increased intracranial pressure is there. Okay, so that is what the altered mental status and lethargy came here. Okay, something wrong with brain, something wrong with GI system. Okay, so next come to the altered consciousness and rapid breathing is there. Based on the clinical presentation, what is the most likely diagnosis? Yes, almost all of you have given the correct answer. So here the child is taking the aspirin, and the child is taking the aspirin and he is having the viral fever, means the child is at the highest risk of the Reye syndrome. Okay, so the child is having the highest risk of the Reye syndrome. Okay, so what happens? Do remember, if the child is having the flu or the viral fever and you are treating that child with the aspirin. Okay, so this may causes a child to land into the Reye syndrome. So this Reye syndrome is important for your exam. Okay, so this Reye syndrome is important for your exam. So which two very important organ it will get damages in the Reye syndrome? The first organ which will damage in the Reye syndrome is the liver. Okay, so due to the damage to the liver, okay, the child may get land into the jaundice and many more symptoms. Okay, and again very important, second most important organ it will damage is the brain. Yes, which are the two organs will damage in the Reye syndrome? First one is the liver, second one is the brain. So due to the damage to the brain, the altered level of consciousness will get altered, and the child will be lethargic and child will be drowsy. Okay, so very important, please do remember. So that is the reason whenever the child is having any viral fever or the flu like symptoms, don't give the aspirin. If you are giving the aspirin, okay, it will cause the Reye syndrome. Reye syndrome will damage the mainly two organs, that is the liver and brain. Okay, so child may get land into the jaundice, and or the child may show the symptoms like altered level of the consciousness, lethargic, and the drowsy. Hope it is clear to every one of you. Yes, so here comes to the next question. Yes. The question is very simple. A 45-year-old patient undergoing the chemotherapy for the breast cancer. So what happened here? A 45-year-old patient is there. She is undergone the chemotherapy for the breast cancer. Okay, and she is now experiencing the nausea and vomiting. Okay, which of the following treatment the oncologist decides to prescribe the medication to prevent the chemotherapy-induced nausea and vomiting? Yes, which of the following is the considered as the first line treatment for preventing the acute chemotherapy-induced vomiting? So the question is there in the last one word. So that is the first line treatment for preventing the acute chemotherapy-induced vomiting. Okay, so here what happened? The woman is there, 45-year woman. So she is exposed to the breast cancer. So now the oncologist have started the chemotherapy. Okay, so in the chemotherapy, now she is experiencing the severe vomiting due to the chemotherapy. Okay, so the first line drug we are giving here is the option A ondansetron, option B dexamethasone, option C allopurinol, and option D levodopa plus carbidopa. Beta levodopa plus carbidopa are the drug we are using in the treatment of the Parkinsonism. So we are not using here. So I am eliminating the option D. Okay, next come to the allopurinol. Okay, allopurinol is the drug we are using in the treatment of the gout. Okay, so that is the junction oxidase inhibitor. So we are using in the treatment of the gout. So that is the allopurinol. Okay, so I am eliminating the option C also. Then comes to the option B, that is the dexamethasone. Okay, so dexamethasone is a steroid which will not reduce the vomiting in a such a extent. Okay, so I am eliminating the dexamethasone also. The answer goes to the ondansetron. Okay, in the clinical setting, this ondansetron we also call this one as in the injection MCET. Okay, so in the prevention of the and treating the chemotherapy induced vomiting, we will give the injection MCET or the injection ondansetron 8 mg. Okay, so before starting the chemotherapy and after completing the chemotherapy, means in the pre-chemo drugs also ondansetron included, and in the post-chemo drugs also ondansetron included. Why? Because it is having a very common side effect of the chemotherapy is the vomiting. Okay, so please do remember the very important two golden words. Okay, so most common side effect of the chemotherapy is, yes, what is the most common side effect of the chemotherapy? The most common side effect of the chemotherapy is the, yes, that is the vomiting, right? Nausea and vomiting. And what is the most common side effect of the radiation therapy? Most common side effect of the radiation therapy, yes, lethargy is the most common side effect of the radiation therapy. Okay, so very important two drugs. So it will be comes in your exam. Okay, here comes to the next question. Yes, which of the following is the potential side effect of the quinine therapy? Which of the following is the potential side effect of the quinine therapy? Option A hyperglycemia, option B comes here as the hypoglycemia, option C is the hypertension, and option D is the tachycardia. So what goes to the correct answer? Which of the following is the potential side effect of the quinine therapy? But this quinine therapy we are using in the treatment of the malaria. Okay, sir, what is the malaria? Let me explain what is the malaria. Malaria is it is in the infection which happens due to the agents, causative agents, which is called as in the plasmodiums. Okay, like we have the various plasmodiums like Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium, yes, one more Plasmodium malariae. Okay, so total 4 plasmodiums are there. So in the India, so which one is common in India? Plasmodium vivax is common. Okay, so yes, well done. Okay, so these causative agents of the malaria, we call that one as the plasmodiums. Okay, so what is the vector of the malaria? Okay, what is the vector of the malaria? Important question. Vector of the malaria is, yes, so that is the female Anopheles mosquito. Okay, female Anopheles mosquito is the vector of the malaria. Okay, so what is the vector of the dengue? Yes, what is the vector of the dengue? So do mention your answer in the comment box. Vector of the malaria is the female Anopheles mosquito. What is the vector of the dengue? What is the vector of the dengue fever? Yes, the dengue fever vector is the Aedes aegypti. Okay, so that is the correct answer. Okay, next here the question comes to the drug of choice in the malaria. What is the drug of choice in the malaria? In the malaria, drug of choice is the chloroquine. Please do remember. Chloroquine is the drug of choice for the malaria. Very, very important. If someone asking the question like this, drug of choice in the malaria in the pregnancy, again answer goes to the same, chloroquine. Chloroquine is the drug which is drug of choice in the malaria also, and drug of choice in the malaria in the pregnancy also. So very, very important golden points. Okay, if someone is asking you the question, anti-malaria drug which is contraindicated in the pregnancy, C by I is here is the which is contraindicated in the pregnancy. Yes, So in the pregnancy, PRI, and here also PRE, PRI. Okay, so Primequine is the drug which is contraindicated in the pregnancy. Please do remember, in the pregnancy we will not give the Primequine. So Primequine is the drug we are using in the prevent of the relapse of the malaria. Okay, so drug of choice for the preventing the relapse of the malaria is the Primequine. Primequine is the drug of choice in the preventing the relapse of the malaria, and anti-malarial drug which is contraindicated in the pregnancy is the Primequine is the drug which is contraindicated in the pregnancy, which is very, very important. So this is the very, very important. So you have to remember. Yes, beta. I told in the last slide that the drug of choice for the malaria is the chloroquine, and drug of choice for the pregnancy, malaria in the pregnancy is also chloroquine. Okay, so if the chloroquine is resistance, okay, malarial agent which is resistance to the chloroquine, okay, so then the drug of choice in the chloroquine resistance malaria, okay, directly to the malaria we are giving the chloroquine. Now the malaria is resistance to the diarrhea, malaria is resistance to the chloroquine. So what goes to the next drug of choice here? Yes, that is the quinine. Okay, so quinine is the drug of choice for the chloroquine resistance malaria. So that goes to the quinine. Okay, so this quinine which is having the side effect, okay, so of hypoglycemia, which is having the side effect of the hypoglycemia. Sir, how means this quinine which will stimulate the beta cells, okay, beta isolate of the Langerhans. So this beta isolate of the Langerhans, it will release as the insulin. What it will do? It will release as the insulin. So this insulin, it will cause the hypoglycemia. So please do remember. So that is the reason whenever you are giving the quinine drugs, so please do give these drugs with the again B5. Okay, so in the dextrose 5% high fluid, you have to mix the quinine drugs, and you have to give the very, very important quinine drugs. Okay, so previously we have studied the Amphotericin B. We have to give that one in the 5% of dextrose. Okay, similarly quinine also we will give the treatment in the malaria of, that is the chloroquine resistance malaria, the quinine we are giving. So that will also causes the hypoglycemia. Okay, so to prevent this hypoglycemia, we need to give the quinine drugs with the by adding the dextrose 5%. Okay, so that is the very, very important thing what you have to keep in your mind. Okay, so next comes to the question. So which of the following is the potential side effect of the quinine therapy? Quinine therapy, the potential side effect is the hypoglycemia, and all the possible important pharmacological things on the malaria we have discussed here. Okay, so here comes to the next question. Yes, a very, very important question, very simple question. Okay, so the question is here in front of you all. So please do read the question carefully, completely, and try to give the best answer in the comment box. Yes, what happens? What happens when metronidazole is taken with alcohol? मजा नहीं आ रहा है क्या क्लास में? मजा आ रहा है कि नहीं आ रहा है क्लास में? Yes. So फटाफट do mention your answers in the comment box. What happens when the metronidazole is taken with alcohol? Option A, which enhances the effect of the alcohol. Option B, significant interaction. Option B, no significant interactions. Option C, disulfiram-like reactions causing the nausea, vomiting, and headache. And option D is the increased metabolism of the alcohol. What goes to the correct answer? If you are taking the alcohol also and metronidazole also. Yes. So you have to remember one reaction here. A very important reaction. Whenever you will drink a beer, that may be a Kingfisher, Tuborg, okay, Old Monk. So whatever it may be, your own personal brand. Okay, so if you are drinking the alcohol, you are drinking the ethanol or methanol. Yes, you are drinking the ethanol or methanol. Which alcohol is used for the drinking, ethanol or methanol? Are you drinking ethanol or methanol? Okay, so that's the correct answer, ethanol. Okay. Please 1 minute. Some disturbance is there. Yes. So Answer goes to the ethanol. Okay, so this ethanol, whenever the person will increase drinks, or the whenever the person will have the ethanol or the alcohol. Okay, so alcohol. Okay, so in this particular situation, what happens? This alcohol or the ethanol, with the help of the alcohol dehydrogenase enzyme. Okay, so dehydrogenase enzyme, it will convert the ethanol to the acetaldehyde. Okay, so this acetaldehyde, with the help of the acetaldehyde dehydrogenase enzyme, it will get converted into the acetic acid. Okay, it will get converted into the acetic acid, right? So this acetic acid, it will get excretes out of the body. Okay, it will get excretes out of the body. Okay, so whenever the person is having the a drug called as the metronidazole, it will blocks the aldehyde dehydrogenase enzyme. Okay, metronidazole, it will blocks the aldehyde dehydrogenase enzyme. That time the chemical acetaldehyde will build in the body. So whenever there is the excessive increase in the acetaldehyde, okay, that time the person will feel nausea, vomiting, chest tightness, chest pain or the chest tightness. Okay, so along with that the throbbing headache, okay. So usually we will use one anti-abuse drug called as the disulfiram. So that disulfiram, similarly it will do the function like it will blocks the acetaldehyde dehydrogenase enzyme. Okay, so whenever the disulfiram, it will block the acetaldehyde dehydrogenase enzyme. So that time again the acetaldehyde will build in the body, again the same symptom, nausea, vomiting, okay, chest pain, throbbing headache, it will comes in the patient. Okay, so this is what you call as the disulfiram like reaction. Okay, so this disulfiram like reactions which happens when the patient will takes the alcohol and the metronidazole together. So that is the reason in the backside pocket of the metronidazole, okay, they have clearly mentioned that in the red big word. So don't take the metronidazole and alcohol together. Okay, if you are taking the metronidazole and alcohol together, you will experience the nausea, vomiting, chest pain, throbbing headache, everything. Okay, that is the reason. So the question will come. Okay, so before administering the metronidazole to the patient, okay, so doctor will ask for the which history. Yes, the patient is in the daily drinker or not. So the doctor should and must ask before giving the metronidazole. If he is not a daily drinker, then only metronidazole we need to give. Otherwise the patient will feel all these sign symptoms called as the chest pain, throbbing headache, nausea, vomiting, many more. Okay, so that is a very very important thing. And comes to the question, what happens if the metronidazole is taken with the alcohol? Okay, so don't give the metronidazole in an alcoholic patient. If we give like this, it will cause the disulfiram like reactions like nausea, vomiting, and the headache. Okay, so this is the how actually disulfiram reactions will happen. Okay, so that the ethanol will get converted into the acetaldehyde with the help of the alcohol dehydrogenase enzyme. Okay, alcohol dehydrogenase enzyme, and this acetaldehyde, it will get converted into the acetic acid. Okay, with the help of the aldehyde dehydrogenase enzyme, and this acetic acid will get expressed in the body. If the person is taking the disulfiram or the metronidazole, the acetaldehyde will not get converted into the acetic acid because it is blocking the aldehyde dehydrogenase enzyme. So this acetaldehyde is not converting into the acetic acid, means this acetaldehyde it is keeps on building in the blood. Okay, when the acetaldehyde it will keeps on building in the blood, so that it will cause the reactions called as the alcohol acetaldehyde ethanol reactions or the disulfiram ethanol reactions it will cause. Okay, so that is a very very important point you have to keep in your mind. Okay, so here comes to the next question. Which of the following drug is not commonly used in the treatment of the leprosy? Yes, which of the following drug we are not using in the treatment of the leprosy? Option A goes to the rifampicin, option B goes to the dapsone, option C goes to the clobazam, and option D goes to the metronidazole. So before going to the answers, I want to tell some golden words on the leprosy. So leprosy causative agent is, what is the causative organism for the leprosy? Yes, that is the brother of the TB. So that is the brother of the Mycobacterium tuberculosis, that is the Mycobacterium leprae. Okay, Mycobacterium leprae. So this is the causative organism for the leprosy. Okay, so this leprosy we also call as the Hansen's disease. What we call this one as in the Hansen's disease. Okay, so very importantly, please do remember what is the another name of the leprosy. So that is the Hansen's disease. Okay, so the causative organism is the Mycobacterium leprae. Okay, so that is the very important. In this Mycobacterium leprae, or in the treatment of the leprosy, we are using these three drugs. That is the Rifampicin, dapsone, clopazimine. Sir, how to remember that one? Dr. Clopa. Okay, dapsone, rifampicin, and the clopazimine. Okay, so do you remember the drugs which we are using in the treatment of the leprosy? That is the Dr. Clopa. Sir, among these all, which one is the drug of choice? Yes, what is the drug of choice for the treatment of the leprosy? What do mention your answer? Yes, I told these three drugs. That's the rifampicin, dapsone, and the clopazimine we are using in the treatment of the leprosy. So answer goes to this particular question, which is we are not using is the methotrexate, which we are not using is the methotrexate is the drug which we are not using. Okay, so we are using rifampicin, dapsone, and the clopazimine we are using. Okay, so among these three, which one is the drug of choice? Yes, so the dapsone goes to the drug of choice. Okay, so dapsone is the drug of choice for the our very important disease called as the leprosy, and rifampicin is the bactericidal drug. Okay, it is in the bactericidal drug. Okay, so both dapsone and clopazimine are the bacteriostatic drugs. It will stop the growth of the bacteria. That is the dapsone and the clopazimine. But the rifampicin is the bactericidal drug which will kills the bacteria. Okay, so that is the reason if someone is asking most effective drug. Most effective drug in the treatment of the leprosy is the our rifampicin. Okay, so rifampicin is the most effective drug, and dapsone is the drug of choice, and clopazimine is the associative drug we are using in the treatment of the leprosy. Okay, so among these two, dapsone and the clopazimine are the bacteriostatic drugs, means only which will stop the growth of the bacteria, and rifampicin is the bactericidal drugs. Okay, so that is the reason the most effective drug in the treatment of the leprosy, most effective is the our rifampicin. Drug of choice is the dapsone. So please do remember the very important two questions and concept, and the causative organism Mycobacterium leprae, and another name is the Hansen's disease. Okay, so that is the very important golden point discussion on the rifampicin and dapsone and the clopazimine. And one more very important thing you have to remember, so that is the dapsone side effect. Okay, dapsone side effect you have to remember. So dapsone is the drug of choice in the treatment of the leprosy. Okay, it will causes the G6PD deficiency. It will causes the G6PD deficiency. Okay, so in the glucose 6-phosphate dehydrogenase. Okay, so G6PD deficiency is happening, means so that time it protects the red blood cells. Okay, so normal function of the G6PD is to protect the red blood cell, and it will won't allow the red blood cell to get damaged. Okay, so here the G6PD is deficiency means yes, there is a more hemolysis will be there. Okay, so there is more hemolysis will be there. Okay, so more hemolysis means yes, there is the chance of the hemolytic anemia will be there. Okay, if the patient is taking the dapsone. Okay, so please do remember the very important side effect of the dapsone. Okay, so that is the G6PD deficiency, more hemolysis, anemia. Okay, so this is the golden word and golden point, so you have to remember on the dapsone. Okay, here comes to the next question in front of you. So please do remember the question and give the best answer, and read the question perfectly first. Okay, so then comes to the options, then comes to the answer in the comment box. Which of the following is the major side effect of the bedaquiline? Previously in the old books, the drug of choice for the treatment of the multi-drug resistance tuberculosis is the moxifloxacin or any other second line drugs they used to give. Yes, in the multi-drug resistance tuberculosis. What is the multi-drug resistance TB? What is the multi-drug resistance of the TB? So first line drugs, that is the isoniazid plus rifampicin. Okay, so for these two drugs, the tuberculosis or the TB, Mycobacterium tuberculosis resistance. Okay, if the Mycobacterium tuberculosis resistance, so we call this one as the MDR-TB. Okay, that is the multi-drug resistance TB. Okay, so for this one, previously the drug of choice was the moxifloxacin. Okay, so now the drug of choice or the new drug in the treatment of the tuberculosis is the bedaquiline. Okay, so now the drug of choice for the MDR-TB is the Drug of choice for the MDR-TB is the Bedaquiline. Okay, this is the new drug. In the treatment of the TB, the Bedaquiline is the new drug, and we are using this one in the MDR-TB. Okay, so that is the very, very important thing. Okay, so BPAM also was the regimen, so I will discuss that one while explaining the TB in the next sessions. Okay, so that is the very, very important regimen. It's the combinations of the drug which have came and approved by the government of India also. So that one already in the updates of the video. So I have already discussed in the updates video. Okay, so again I will discuss in the while explaining the tuberculosis. Okay, so very important. Then comes to the questions here. Okay, what actually the question was asked here? Which of the following is the major side effect of the Bedaquiline in the treatment of the MDR-TB? Bedaquiline is the very, very important drug. Okay, so which we are using in the treatment of the MDR-TB and which is having the side effect of the QT interval prolongation. So that is the reason while administering the Bedaquiline, always you have to regular the ECG monitoring and requires the during the treatment process. Okay, so that is the very, very important because it is having the risk of the cardiac arrhythmias. Okay, so it is having the risk of the cardiac arrhythmias. So please do remember the before giving the Bedaquiline, we need to take the ECG once, and on the treatment process, we need to monitor on the ECG. Okay, so because it is having the risk of the cardiac arrhythmia. Okay, so please do remember the very, very important word and very, very important concept here. Okay, on the Bedaquiline, right? This is the new drug, so there may be a chance of the asking the questions is there. Okay, so next question comes to here like this. So please do read the question carefully, completely. Which of the following anti-TB drug is considered bacteriostatic rather than the bactericidal? Yes, only one drug which is there here is the bacteriostatic, so remaining all are the bactericidal. Okay, so option A comes to the Rifampicin, and option B comes to the Isoniazid, option C comes to the Paracetamol, and option D comes to the Ethambutol. Students, these all are what you are there in the options. These are the first line drugs we are using in the treatment of the tuberculosis. That is the Rifampicin, Isoniazid, Paracetamol, and Ethambutol. Yes. Which drug among these is the bacteriostatic drug? Option A, Rifampicin. Beta, while explaining the leprosy treatment, I told the Rifampicin is a dangerous and a very important and the most potent bactericidal. Okay, so this is the bactericidal. What is the bactericidal here? Cidal means which kills the bacteria. Okay, which kills the bacteria is the cidal. Okay, and which stop the growth of the bacteria is the statics. Okay, bacteriostatic means the drugs which will stop the growth of the bacteria is the bacteriostatics. Okay, bactericidal means yes, the drugs which will kills the bacteria is called as the bactericidal. So in the first line treatment of the tuberculosis, we have the bacteriostatics also, bactericidal also. Among these, which one is the bacteriostatic is the question. Okay, so option A is the Rifampicin, which is the bactericidal drug, and Isoniazid also bactericidal drug, Paracetamol also bactericidal drug, and only one drug, that is the Ethambutol. Okay, so Ethambutol is the only drug which is the bacteriostatic drug. Okay, which is the bacteriostatic drug in the treatment of the TB. Rest all are the bactericidal drugs. Okay, so this goes to the correct answer, option D. Okay, so option D goes to the correct answer here. Okay, yes, so hope it is clear to every one of you. So here comes to the next question. Which of the following is the most commonly used drug for the prophylaxis of the high risk individuals in the TB? So the drug used in the prophylaxis of the tuberculosis in the high risk individuals, which drug is the used in the prophylaxis of the tuberculosis? Option A comes to the Isoniazid, option B is the Rifampicin, option C is the Ethambutol, and option D is the Paracetamol. So same options. Yes, I want the answer. Which of the following drug is most commonly used in the treatment of the in the prophylaxis of the high risk individuals to prevent the TB? So yes, the prophylaxis for the TB is the Isoniazid. So please do remember the very, very important word. Okay, so this Isoniazid we are using in the prophylaxis of the tuberculosis, right? So here is the golden points we need to remember on the Isoniazid, that it is in the mycolic acid inhibitor. Okay, so in the Mycobacterium tuberculi, so there is in the one proteinous substance, we call that one as the mycolic acid. Okay, so it will there in the cell wall of the Mycobacterium tuberculi. Okay, so we are giving the Isoniazid means it will blocks the formation of the mycolic acid. Okay, so it is inhibiting the synthesis of the mycolic acid, means there is no cell wall formation for the Mycobacterium tuberculosis, and Mycobacterium tuberculosis will start die. Okay, so that the isoniazid is the bactericidal drug, okay, and which we are using to inhibit the synthesis of the mycolic acid by the bacteria called as the Mycobacterium tuberculosis. Okay, so the isoniazid is the drug of choice for the prophylaxis of the tuberculosis. In the prophylaxis of the tuberculosis, the drug of choice is the isoniazid, very, very important point. Then comes to the liver function should be monitored during the therapy because it is very, very important. Why? Because the isoniazid is having the maximum potentiality to cause the damage to the liver. Okay, so which is having the maximum potentiality to cause the damage to the liver. It is the second most highest drug to cause the damage to the liver. So which is the first most highest drug? Okay, among these all four drugs. Okay, so there is the isoniazid, rifampicin, ethambutol, pyrazinamide. So which one is the most khatarnak drug which is causing damage to the liver? Which is the most dangerous drug which is causing the damage to the liver? So please do remember the mnemonic, that is the rest in peace. So we have to write it in reverse manner. Okay, so that is the rest in peace or the RIP. Okay, how will write this one? Yes, RIP we will write in the reverse manner, right? So that is the pyrazinamide is having the maximum effect on the liver and it will cause the maximum liver damage. Maximum liver damage will be caused by the pyrazinamide. And the second highest drug which is causing the liver damage is the isoniazid. And the third highest drug which is causing the liver damage is our rifampicin. Okay, but streptomycin and ethambutol, these both drugs are nephrotoxic, which will damage the kidney. Nephrotoxic drugs are our side effect. That is the streptomycin and ethambutol are the nephrotoxic, and the rest in peace, that is the RIP in ulta, which is the drugs which will cause the maximum damage to the liver. Okay, so the maximum is our pyrazinamide. Okay, then the second one is the isoniazid, and the third one is the very, very important rifampicin. Okay, so in the isoniazid, I told it will cause the gynecomastia and it will cause the peripheral neuropathy and euphoria also. Okay, and one more very important golden point you have to remember on the isoniazid. Isoniazid is the drug which will maximum crosses blood-brain barrier. Okay, so it will causes the euphoria. Sir, how it will cause the euphoria? Okay, so please do remember the concept here. I told isoniazid is the drug which is having the ability to cross the blood-brain barrier. Okay, maximum it will crosses and it will enter into the brain. Okay, what it will do in the brain? Okay, in the brain we have the one very important neurotransmitter. What we call that one is the GABA amino. Okay, gamma amino butyric acid. Okay, so that is the GABA. Okay, so this GABA is very much responsible for keeping the brain cool, calm, and relaxed. Okay, if the GABA is decreasing, means the brain will be not be cool, brain will not be calm, brain will not be relaxed. If the GABA is decreasing, means yes, anxiety will increase. GABA decreasing means anxiety will increases. Okay, and if the GABA is decreasing, means person will feel the euphoric. What is the euphoria? Yes, a false sensation of the well-being. Okay, for the temporary false sensation, a person will feel he is very well, he is very nice. Okay, so patient is having the khansi due to the TB. What is the khansi? Cough, and he is having the hasi, so that is the smile on the face. Khansi in the chest, smile on the face. So that is the which we will see in a case of the tuberculosis who is taking the isoniazid. Okay, isoniazid is the maximum drug which is having the maximum potential to cause the blood-brain barrier and which will cause the damage to the brain. Okay, it will decrease the GABA and it will cause the euphoria and it will cause the anxiety, and sometimes it will land the patient into the seizure. Okay, so that is the very, very important concept you have to keep in your mind. So that is related to the isoniazid. Okay, so whenever the patient is taking the isoniazid, the CNS symptoms will be more. Okay, so along with this one, the isoniazid is, I told, it is the second highest drug which will cause us the liver damage. Okay, so whenever there is the liver damage is there, so that time the patient will experience the gynecomastia. Sir, how liver damage will cause the gynecomastia? Sir, what is the gynecomastia? Gynecomastia means in the males, the breast will looks like a female's. Okay, so the large breast will be there in the male, so that is what we call as the gynecomastia. How, sir? How means? Consider, I told the isoniazid is the drug which is second highest drug which will cause the damage to the liver. Okay, so this liver, normally what it will do, it will causes the activated estrogen. Okay, it will comes to the liver in the male and it will get inactivate normally. Okay, so what happened in the normal in the males? In the males also estrogen is there, so that is the activated estrogen. It will comes to the livers and it will get inactivated. It is the normal process. Whenever the patient is taking the isoniazid, that time there is a damage in the liver will be there. So damage to the liver means this activated estrogen, it will not get converted into the inactivated estrogen. Okay, so activated estrogen which increased in male body. Okay, so activated estrogen, it will increase in the male body. So it will causes the main hormone which is responsible for the growth of the breast is the estrogen. Okay, so the growth of the breast will happens in the male. Okay, growth of breast, it will excessively happens in the male. Okay, which will happens excessively in male. So we call this one as in the case of the gynecomastia. Okay, yes, isoniazid it is causing the gynecomastia. Isoniazid it is causing the anxiety, euphoria, seizures. Okay, so which is having the maximum potential to crosses the blood-brain barrier and it will crosses the brain easily and it is decreasing the GABA. Okay, so that's the very important thing. Side effects of the isoniazid and the actual concept behind the isoniazid. So I have explained to you people. And one more golden point, just you have to remember the bar, the question will come in the exam. There is the peripheral neuropathy and the isoniazid. Beta. So isoniazid, it will causes the peripheral neuropathy also. So if the patient is on the anti-tubercular drug, especially in the isoniazid, who is complaining of the tingling sensation, pricking sensation over the lower limbs or in the upper limbs, especially at the periphery of the body. So what it means? It means the patient is undergoing the severe vitamin deficiency. That is the severe deficiency of the vitamin B6. That is the pyrazinamide. Okay, sorry, that is the pyridoxine. Okay, so patient who is taking the isoniazid, if he is complaining of the sign of the peripheral neuropathy, that is the tingling, pricking, and the parastatic sensation at the lower limbs. Okay, so that is the very importantly it indicating the peripheral neuropathy. And to prevent the peripheral neuropathy, we need to give the vitamin that is called as the vitamin B6. Okay, and this vitamin B6 we also call as the pyridoxine. Okay, what is this one? This is the pyridoxine. Okay, in the clinical settings we call this one as the Benadone. Tablet Benadone means tablet vitamin B6 or the pyridoxine. So we will give this one along with the patient who is taking the anti-tubercular drug. Okay, so this is a very important beta. So relationship of the isoniazid and the peripheral neuropathy and the vitamin B6 was repeatedly asked in your exam. So that is what I have explained all the very important on the isoniazid. And do remember the drug of choice for the prophylaxis of the TB is the isoniazid, and the main side effect is the peripheral neuropathy, and the earliest side effect is the peripheral neuropathy. Most common side effect also peripheral neuropathy. To prevent this one, we will give the vitamin called as the vitamin B6, that is the pyridoxine. In the clinical settings, we call this one as a tablet Benadone. Okay, so that's the orally we will give the very important vitamin B6 replacement here. Okay, so next comes to the point of the discussion. The next question is here in front of you. So yes, do read the question carefully, completely, then try to get the best answer. Again, the question is on the isoniazid. Okay, so what side effect which requires the immediate discontinuation of the isoniazid? I told isoniazid is the second most highest drug of the anti-tubercular drug which will cause the liver damage. Okay, if the patient is having the jaundice, then we will stop the or we will immediately discontinue the drug. Okay, so neuropathy happening means we will give the vitamin B6. Okay, so we will not stop the ATT. If the neuropathy is happening means we will give the vitamin B6 or the pyridoxine. Okay, so vitamin B6 we will give and the pyridoxine we will give if there is in the neuropathy happening means. Okay, we will not stop, but the jaundice happening means we need to stop the isoniazid and we need to inform the doctor immediately. Okay, so that is the very important. Okay, do read the do understand the concept behind this one. Okay, so the next question comes here in front of you. So please do read the questions. Yes, beta. Is there any issue? Is that class going fast? No, but this class is in the rapid revision class. No, it's rapid revision means it will be a concept will be explained rapidly, perfectly. Okay, so for completely clearly. Okay, if you feel it is the fast, you can keep this one video at the 0.5 speed and you can watch. Okay, because other students also they will complain against that the class is going slow. Okay, if I am saying fast, you can keep it slow, no problem. Okay, yes, so no problem. Okay. So next, here's the next question. What is the drug of choice for the acute management of the paroxysmal supraventricular tachycardia in the PSVT? In the PSVT, there is the paroxysmal supraventricular tachycardia. So which one is the drug of choice in the management of the PSVT? Yes, I'm waiting for your answer in the comment box. So fatapat do mention your answer. Barley, answer barley, fatapat. What is the drug of choice? I want answer from everybody who are live to the class. Yes. What is the drug of choice for the acute management of the PSVT? That is the paroxysmal supraventricular tachycardia. Amiodarone, adenosine, metoprolol, verapamil. So what goes to the correct answer? Yes. Well done, beta. So almost all you people have given the correct answer. So that is the in the acute management of the PSVT. So the drug of choice goes to the adenosine. Okay. So please do remember adenosine is the drug of choice for the acute management of the paroxysmal supraventricular tachycardia. Okay. So the answer and the question was repeatedly asked in your exam. Okay, so don't forget this one. Okay, yes, amiodarone also we are using in the arrhythmias, but the drug of choice here goes to the adenosine is the drug of choice for the PSVT. Okay, so next comes to the metoprolol and verapamil. Metoprolol is the beta blocker, and verapamil is the calcium channel blocker. Both are reducing the heart rate. Okay, both are reducing the heart rate. Sir, whenever if the patient comes with hypertension, can we give the beta blockers? Yes, we can give the beta blockers because it reduces the heart rate and it will reduces the blood flow to the vessels. Okay, so we can give. Can we give the calcium channel blockers? Sir, yes, we can give. Sir, can we give the together both? Never ever. If you are giving the combination of the beta blockers and the calcium channel blockers together, it will cause the patient lands into the severe heart rate decrease. So that is the patient will land into the severe bradycardia. Okay, the patient will land into the severe bradycardia. Okay, so that is the very important thing. So please do remember. Okay, so if the patient is having the metoprolol and verapamil, so together he is taking means the patient will land into the severe bradycardia. So don't never ever try to give the metoprolol and verapamil, that is the beta blockers and calcium channel blockers together. Yes, independently, both separately we can give. Okay, so not together. Hope this concept is clear. Okay, here comes to the next question. Which of the following drug interaction is a result of the rifampicin induction of the enzyme? Option A goes to the increased level of the warfarin. Option B goes to the decreased effectiveness of the oral contraceptive pills. Option C goes to the increased absorption of the digoxin. Option D is the decreased metabolism of the phenytoin and the nevirapine. So what is the correct answer? Which of the following drug interaction is a result of rifampicin induction of the enzyme? So first you understand what is the concept of the induction of the enzyme. Beta, induction of the enzyme means it will increase the enzymes. Okay, so enzyme is increasing means metabolism is increases. Metabolism is increasing means excretion will increases. Excretion is increasing means effectiveness is decreases. Okay, so please do remember. So here our drug, that is the anti-tubercular drug, that is the Rifampicin, which is having one unnecessary effect, that is the induction of the enzyme. Means it will increase the enzymes. Okay, so when the enzymes will increase in the body, the metabolism will increase in the body. So excretion of the other drugs which we are giving along with the inductions of the like enzymes, so that excretion of the medications also it will increases, and the effectiveness of the drugs which will decreases. Okay, sir, I told Rifampicin is having the okay, so Rifampicin is having the effect of the induction of the enzyme. Okay, sir, along with this, if we are giving the drug called as the now, so that is the Nevirapine. Okay, so that is the Nevirapine. Oral contraceptive pills and the Warfarin. So if we are giving the Rifampicin and Nevirapine, OCP and Warfarin together, means the Rifampicin will increase the metabolism of the Nevirapine, and it will increase the excretion of the Nevirapine, and it will eliminate the Nevirapine early, and it will decrease the effect of the Nevirapine, decrease the effect of the Nevirapine. Similarly, it will increase the metabolism of the oral contraceptive pills, it will increase the excretion of the oral contraceptive pills, and it will reduces the effect of the oral contraceptive pills. Along with that, it will increase the metabolism of the warfarin, it will increase the excretion of the warfarin, and it will eliminate the it will decrease the effect of the warfarin. So that is the reason these particular three drugs, if the patient is taking, so don't give the Rifampicin. If you are giving the Rifampicin, yes, this drug effect will get decreases, especially OCP effect is decreasing, means it is very dangerous. Why? Because the female will come to your OPD for the promoting her or the maintaining the gap between the two pregnancy. Okay, so now you advised the OCP and she is already a case of the TB and she is taking the HET. Okay, so you have advised OCP. So now the Rifampicin reduces the effectiveness of the OCP. So she have took the medication, but again she get pregnant because of the decreased effectiveness of the OCP in the Rifampicin effect. Okay, so she will comes again to your OPD, sir, I have came to you to postpone or to maintain the gap between my two pregnancies. You have given the waste drug. Okay, so that again I got pregnant, she will tell. Then you will ask for the history. She is the case of the what we can say tuberculosis, and she is taking the HET also. Then you will come to know that this is the effect of the induction of the enzyme. Okay, so yes, so this was the many cases will happens like this. Okay, so before the starting OCP, we will ask for the history of the tuberculosis and the HET drugs and the Nevirapine also and Warfarin also. Okay, so then comes to the question here on the induction of the enzyme. Which of the following is the drug interaction is the result? Okay, option A, increase the level of the warfarin. Beta, warfarin is eliminating more, so it will decrease the function of the warfarin. Okay, it will decreases, not increases. Remember, right? Then option B is the decreased effectiveness of the oral contraceptive pills. Yes, the effectiveness of the oral contraceptive pill is decreasing because the more metabolism of the OCP, more elimination of the OCP, decreases the effect of the OCP. Okay, so then comes to the option C, increased absorption of the digoxin. It is not related to this one. Okay, so option D is also not related to the question. So but Nevirapine action it will decreases, but it will not decrease the phenytoin effect. Okay, so do remember the mnemonic what I told here is the now Nevirapine effect decreases, OCP effect decreases, warfarin effect decreases. Okay, in the option D they have given decreased metabolism. Beta, there is metabolism will increases, it will not decreases. Okay, so metabolism is increasing, excretion is increasing, but effectiveness is decreasing. Okay, so that is the option D also goes to the wrong here. Okay, so hope it is clear to every one of you. The induction of the enzyme by the Rifampicin will causes the decreased effectiveness of the oral contraceptive pills. So that is the reason we can advise the woman to go for the secondary contraceptives also, for that is the physical contraceptives. So physical methods we will advise that the condoms or the FC2, the female condom with 2 rings, we can advise that one also. Okay, so very important one. Okay, so here comes to the next question. Yes, I told this was the last question and this is the last shot on the pharmacology. So all the important questions with clear-cut explanation and the perfect content, I want to close the pharmacology because it is important for you all, and there is the 6 to 8 questions will arise on the pharmacology directly, indirectly in our Norcet. Okay, so just you are fixing those questions means yes, definitely it will help you, because only few students are there who know the pharmacology, and only few students are there who will attempt the questions of the pharmacology. If you are among those few students who know the pharmacology and who attend the questions on the pharmacology and who will make the correct answers on the pharmacology, definitely it will improve your performance, it will improve your rank, and you can choose the aims which is near to your home, and you can get select there, and you can work as a nursing officer with a 90,000 plus salary. Okay, so which is near to your home. Okay, so that is the reason. Read the pharmacology, understand the pharmacology, and love the pharmacology, because this is the a subject where you will never get sleep while studying. Okay, so that is the very important thing you have to keep in your mind. Okay, so here comes to the next question. Which of the following lab tests should be monitored during the treatment of pyrazinamide? Yes, during the treatment of the pyrazinamide, which of the following tests you should and must perform? So, students, while explaining the thing, I told the rest in peace. Okay, so that is in the reverse direction, and I told here the P, that is the maximum liver damage will happen due to the pyrazinamide, and the second one is the isoniazid, then third one is the rifampicin, and the ethambutyl streptomycin. Okay, these will two causes the nephrotoxicity. Okay, so not the liver damage, right? So here the pyrazinamide, which is having the highest chance of the liver damage. Okay, so first time the maximum potential drug which causes the liver damage, so that is the pyrazinamide. So before starting the pyrazinamide and before starting the ATT, we must and we should check for the liver function test and the kidney function test both. Okay, but especially if the question comes to the very important point from the pyrazinamide, so that is the liver function test goes to the primary test we have to do, because the pyrazinamide is having the ability and potentiality to damage the liver. Okay, so it is the maximum damage to the liver by the pyrazinamide will happen. Okay, yes, we will do the CBC also, we will do the kidney function test also, we will do the liver function test also before starting the anti-tubercular drug. But pyrazinamide means specifically we will asking related to the LFT, so the answer goes to the LFT, that is the liver function test. Okay, so that is the clear. Okay, so next comes to the question here. Which of the following is the common side effect of the rifampicin on the urine color? Yes. Which of the following is the common side effect of the rifampicin in the urine color? Option A, blue color. Option B, red color or orange color urine. And option C, green color urine. And option D, brown color urine. So, students, while giving some drugs, the counseling is most important. If you are not doing the counseling, means you will get such a very fruitful incidents you can never ever forget in your life. Okay, so in one PHC, what happened? The patient who have diagnosed with the tuberculosis came to the PHC, and a doctor or a primary healthcare provider who is there in the PHC, he has started the AGT, and he was like due to the heavy patients, so he is unable to do counseling to the patient with the who is taking the ATT. Okay, so the patient who took the medications, who went to the home, and as per the advice of the doctor, the 3 tablets or the 4 tablets he took in the home, and after 6-7 days, so he came again back to the doctor with a carry bag, where in the carry bag with complete full of the urines. Okay, he is showing to the doctor that, sir, look at this one, the blood is coming in my urine due to the drugs which you have given. He was explaining, beta, that is not in blood in the urine, that is just a discoloration of the urine. Why? Because the maximum the rifampicin will get excreted by the urine, and it will make the urine to get discolor, and which is not any side effect we can say. Okay, which is in the normally we will expect. Okay, so the normally we will expect. So if we are explaining the patient in the OPD while administering the starting the ATT, that if you are taking these medications, your urine may get discolor, your urine may get red in color, so you don't have to worry. That is the normal thing we have to explain to the patient. Okay, so red or orange color urine in the ATT is not an dangerous side effect. Okay, which we will consider that one as a normal thing only. Okay, so the common side effect of the rifampicin, where the urine color will be red or orange in color, so that is the reason before starting the ATT we will explain to the patient that if you are taking the anti-tubercular drugs, especially rifampicin, the urine color will comes red or orange. Otherwise, the patient will comes to you also with the holding the carry bag which is full of the urine, which is blood in color. Okay, so yes, is that clear to every one of you? Yes. So the next answer goes to the next question goes to the like this. Okay, which of the following is the side effect of is commonly associated with the pyrazinamide and can lead to the increased risk of the gout? Beta. So pyrazinamide, I told the drug which is having the maximum damage to the liver and which is having the one more very important side effect, that the excessive production of the uric acid. Okay, so if the patient is having the excessive production of the uric acid, yes, almost all people given the correct answer, option B. Okay, increased uric acid level. Okay, so increased uric acid level is happening means yes, the patient, it will lands into the gouty arthritis. Sir, why sir? Why? Because this increased uric acid level crystals, it will get accumulates in between the joints of the small and the medium sized joints. Okay, so that is the reason where in the small and medium sized joints there will be a very important inflammation will get produced due to the due to the accumulation of the uric acid. We call it as the gouty arthritis. And in the pyrazinamide, the maximum gout will be seen. Okay, yes, the gouty arthritis may seen in the ethambutol also, in case of the isoniazid also, in case of the rifampicin also, but in the pyrazinamide it is the maximum. Okay, so do remember the very important thing, right? So here comes to the next question. Yes, which of the following is the common and potentially serious side effect of the ethambutol in the treatment of the tuberculosis? Yes, common and potentially serious side effect of the ethambutol in the treatment of the tuberculosis. Option A comes to the ototoxicity, option B comes to the vision changes, and the yes, vision changes including the optic neuritis also, and option C comes to the liver toxicity, and option D comes to the red or orange color urine. Better, I just now only explained the red and orange color urine will be seen in, yes, a urine with a full of carry bag, sorry, the carry bag with a full of urine. Yes, red orange color urine will be seen in case of the, just now only we have discussed, that is the rifampicin, right? So liver toxicity maximum and the uric acid and gouty arthritis maximum in the pyrazinamide. We discussed already, right? The ototoxicity or the hearing loss or the eighth cranial nerve damage, which will happens due to the a drug, we call that known as the streptomycin. Okay, if the patient is taking the ethambutol, you have to remember E and damage to the eye. Okay, so ethambutol is having the a damage to the eye. Okay, so where which will leads to the vision changes. Okay, initially, okay, let me explain both initial and late conditions. Okay, so initially the patient who is taking the ethambutol, initial side effect is color blindness. Okay, so that is the color blindness will happens. So first, which color will give patient will get last, sir? First he will get the red color, then he will get the blindness to the green color. Okay, so very important one. Then after that, in the late condition, okay, so ethambutol, it will get causes the optic neuritis, where the person will permanently land into the blindness. Okay, so this ethambutol is a dangerous drug which will causes the color blindness also as initial period, and after that the patient in the late period it will cause the optic neuritis and the complete blindness also will be experienced by the patient. Okay, so that's the very important thing. Just you have to keep in your mind and remember the things. Okay, here comes to the next question. Okay, so hope the previous question is very much clear. Okay, that is the ethambutol, vision changes, and the optic neuritis goes to the correct answer. Okay, option B goes to the correct answer. Hope it is clear to every one of you. Yes, other drugs also I have explained in this one. Okay, here comes to the next question. Which of the following drug is not commonly used in the treatment of the leprosy? Already I have told the doctor already discussed the question. That is the doctor and the clopa is the Dr. Clopa we are using, and already discussed the drugs. I don't want to discuss this again. And here goes to the a very important question. Okay, so which of the following anti-epileptic drug is considered as the safest during the pregnancy? safest anti-epileptic drug in the pregnancy? Safest during pregnancy, which anti-epileptic drug is that one? Option A is the sodium valproate, option B goes to the phenobarbital, option C goes to the lamotrigine, and option D goes to the carbamazepine, and option E goes to the ethosuximide, and option F goes to the lorazepam. If someone is asking the question to you, that is, which of the following is the drug of choice for the status epilepticus? The drug of choice for the status epilepticus is our lorazepam. Beta, for the status epilepticus, drug of choice is the lorazepam. Do remember the very important thing. Okay. So next is, if someone is asking the question to drug of choice for the option seizure. Drug of choice for the option seizure. Your answer will go to the, for the option seizure. For the option seizure, the drug of choice is the ethosuximide. Very, very important. Do remember. If someone is asking you the drug of choice for the partial seizure, all kind of the partial seizure, the drug of choice is the carbamazepine. Okay, so the drug of choice for the partial seizure is the carbamazepine, and the carbamazepine is also a drug of choice for the trigeminal neuralgia. Okay, so carbamazepine is also drug of choice in case of the trigeminal neuralgia. And if someone is asking the question like this, safest anti-epileptic, safest drug during the pregnancy, that is the lamotrigine, and almost all you people have chosen the correct answer. The lamotrigine is the safest anti-epileptic drug during the pregnancy. Okay, so that is the drug of choice in the pregnancy, or the safest anti-epileptic drug in the pregnancy is the lamotrigine. And the phenobarbital is the second safest. Okay, so this is the first safest we can give, and the second safest, that is the phenobarbital we can give. Okay, sodium valproate is the a drug of choice for the generalized tonic-clonic seizure. Okay, so this is a drug of choice for the generalized tonic-clonic seizure. Yes, quickly revise with me. Drug of choice for the absence seizure is the ethosuximide. Drug of choice for the absence seizure is the ethosuximide. Drug of choice for the status epilepticus is the lorazepam. Drug of choice for the partial seizure is the carbamazepine. Drug of choice for the trigeminal neuralgia is the carbamazepine. And drug of choice for the safest drug during the pregnancy, that is the anti-epileptic drug during the pregnancy, is the lamotrigine. And the drug of choice for the generalized tonic-clonic seizure or the complete seizure is the sodium valproate. Okay, so these are the golden point what we have discussed in this today's class, and hope that today's class is completely enjoyable to every one of you. And here comes to the final and the very, very important suggestions to you people. Students, from entire pharmacology, this question will be repeatedly asked to you all. Along with this, you have to study the antidepressants, okay, and antipsychotics, and lithium. Okay, so these drugs also you need to study, because from here also question will repeatedly asked. So after this class, one more class I will share it to you people. Okay, so that is not tomorrow, so I will share very soon. Okay, so otherwise I will discuss the question in the WhatsApp group. So remaining very important questions. Okay, and here we are winding the a very, very important session on the particular, what we can say, important questions discussion on the what we can say, pharmacology. Okay, so who are already in the paid pack, okay, in the master batch or in the Navagraha plan, you people have the complete explanation of the antidepressants, antipsychotics, lithium, everything, so which was there in the paid course. Okay, so already completely, clearly, perfectly, without missing a single point, we have explained the antidepressants and antipsychotics, lithium, everything in the master nursing classes. Okay, for the free subscribers also, I will make it free for the 2 to 3 days. Okay, so you can watch and finish that one. Okay, so because the exam is near, so nothing is to hide there. Okay, so you can use that one, right? So no problem, right? And every one of you do remember, in the master nursing classes application, okay, in the master nursing classes app, daily free test is going on from the morning 6 a.m. to the 11 p.m. Okay, so daily free all India test, all India Norcet exam is going on. Okay, so that is the free. You can analyze your result where you are standing. And in our test, if you are scoring 55 plus marks, means you have already cleared the prelims, just you have to prepare for the mains. Okay, and if it is coming below 55, above 50, yes, you are in the borderline. You need to work more and you need to like pay little bit extra consciousness, and you have to control on the negative marks. That's the very important one. And all the suggestions, how to control the negative marks, how to improve the marks, everything I have made the video, dedicated videos, and I have kept in our WhatsApp in our YouTube channel, so you can use that one. You can understand the situation and you can understand the practicality, so you can go for that one. Okay, so this don't forget to watch this antidepressants, antipsychotics, and lithium drugs, which was there in the app also. Okay, so it will be helpful for you all. Okay, so hopefully this particular question is very much today's discussion was very much helpful to you all. And here comes to the assignment question to every one of you. So please take the assignment question. That is the drug of choice in trigeminal neuralgia, and second one, drug of choice for status epilepticus. Please do mention your answer in the comment box at the end of the video. Okay, so these are our 2 assignment questions. Hope it is helpful for you. Okay, so just mention question number 1 in front of the one, you have to mention the answer, and just mention question number 2 in front of the question, you just mention the answer. Okay, so these are the 2 very important assignment question to every one of you. So we will meet again in the tomorrow session with the again MS in rapid revision and the golden point chanting. So I hope these particular sessions are very much enjoyable for you all. If it is helping to you, please do subscribe and share and like the particular classes. Okay, thank you so much for watching the classes till then. Jai Hind, Jai Bharat. Bye bye. Take care. Love you all.